I'd like to introduce Pharmacist Stephen Dickson from Scotland. Welcome, Stephen.
Hi, Linda.
Could you tell me when you first heard about LDN?
It was quite a number of years ago. I was working with Tom Gilhooly in Glasgow, in the East End. He was quite heavily involved in addictions treatment, as was I. So when he called and asked if we could make something called low-dose naltrexone, in fact he asked for low-dose naloxone, but never mind, we worked that one out. Basically, I wasn't surprised. I assumed it was to do with his addictions work. So we did a bit of work with him and managed to come up with a formulation to make this product he was asking for, which has low-dose naltrexone. And from there we developed a relationship, and it's been going on ever since.
How many patients do you think you've got on LDN?
I actually did a check today. I can't see how many there are currently. I can say we've now seen over 5,000, and that's in the last sort of 3 to 4 years. Wow. I wouldn't say they're all current. Obviously, it doesn't work for everybody, but yeah, there's quite a lot, certainly. 5,000 people is a lot of people to have seen on one drug.
What would you say has been the most common questions that you've been asked?
Possibly the first one is, how does it work? Which is very difficult to answer, and the answer has changed almost every month for the last 3 years. That's probably the most common one, and it's probably not worth, I wouldn't want to talk about that here, but certainly after that, these side effects, and how long is it going to take before it starts to work, and can I take it with any other medication, and sort of just the general questions people ask whenever they are getting a new medication. The most common one is definitely, how does it work, or is this going to work? Which is a hard
one to answer. But Could you just briefly tell us about drug interaction?
Yes, there are a lot of resources on the internet regarding LDN, and not all of them are entirely factually accurate. Basically, LDN is compatible with most medications that you're on for a chronic disease. It just means sometimes it needs to be done in a slightly different way, or taken in a different way, or your medication that you are taking altered slightly to enable you to take it. The obvious exception to that is on the very strong opiate medications. You really have to be very, very careful not to take the two of those together if you are on a sort of long-term strong opiate painkiller. Not because it's going to do you any major harm or stop the LDN potentially from working, but actually because the LDN would stop the painkiller from working, and if you're on a strong opiate, you're probably on it for a reason. So we take it, take that very carefully whenever anybody contacts us who is on opiate-based painkillers. Now that doesn't mean that you can't still do the drugs. You just have to be quite clever with your timing, and that's where your pharmacist or your doctor can help you with that. Another one of the questions with interactions we get very frequently is, can I take LDN with interferon? Or Tysabri, or any of the newer sort of MS drugs. And certainly there isn't really any logical reason why you can't take the two of them together. And in fact, I could cite hundreds of examples of people who have done exactly that and still derived benefit from the LDN. The original thought was that the two drugs worked in different ways, that the LDN was like a stimulant of the immune system, whereas, for example, a steroid was a suppressor of the immune system. I think what we're finding as time has gone on is that both drugs, interferon and LDN, are modulators of the immune system, but they don't necessarily work on the same subsets of cells or the same receptors, and therefore can theoretically complement each other. So that has been our experience in practice. We have had no terrible side effects or interactions between those two drugs or any of the major drugs when people have taken them together. That information isn't really what you'll get if you go onto the internet, so it's one of the major things that we spend time on when we're talking to people, especially with MS. Especially with MS because they quite often are already on interferon or have had a bad experience with interferon. We see much more nowadays of people who are on other immunosuppressant drugs, people who have a Crohn's disease, or people who have lupus, or people who have the other diseases like fibromyalgia and ME, etc., who have been on quite a wide range of weird and wonderful applications of off-license immunomodulatory drugs. So we've got quite a lot of knowledge now, and we can be quite certain when someone asks us a question that we'll be able to give them an answer of how to go about taking LDN in a safe way.
And steroids is the other question that's being asked.
There is no direct relationship between steroids and naltrexone. For example, the main steroid is prednisolone, and there's no direct interaction between those. Like prednisolone is a bit like a general like sledgehammer to your immune system, and it's great what it does in people who have got a lot of inflammation or a terrible buildup of inflammation. It very rapidly gets rid of that, but it hits every cell across the whole body. So LDN against that, there's no reason to stop taking the LDN if you are prescribed steroids. The only thing that really potentially could happen is that any benefit from the LDN is removed, but certainly that doesn't seem to be the case in most people who have done that. And that would be backed up by some of the research that Rachel Allen has been doing recently, so into different receptors that are involved in some of the autoimmune responses. So it certainly, there is no reason, and we certainly tell people that you can continue to take LDN during the whole period of being on a course of steroids, for example, for a chest infection or for a flare-up of MS or for anything. There's no reason to stop taking it.
And then people ask what happens if they need to go to the dentist and have a filling or a tooth out or go to hospital for an operation.
If you're going to hospital for an operation, we would normally say to people to stop LDN 2 or 3 days before you go in. The absolute latest you would stop is maybe 24 hours before. And that's not really for any reason other than to make it more simple for your doctors in the hospital. If you were to, for example, take an LDN and you were, God forbid, in a car accident, the amount of opiate painkiller they would give you in order to relieve your pain if you had a broken leg or something would completely overwhelm any dose you had of LDN. So the opiate painkiller would still work. Mm-hmm. They might need to give you slightly more, but if it's still complicated. So that's why, I mean, there's not really any major reason to stop taking it before going to hospital, other than it simplifies the job of the doctor while you're in hospital. The same with the dentist. I wouldn't really consider stopping taking it before going to the dentist. The dentists are very limited in the opiates that they can use. Generally, if you're having an operation in the dentists, they'll use a mild sedative that's via a drip, or they'll use an injection, which is a local anaesthetic, and neither of those are affected by LDN in any way.
So what would you say is summing up your opinion of LDN?
Over the last 3, 4, 5 years, I mean, LDN has gone from being something that we were very sceptical of initially, used in a small number of people with multiple sclerosis, to something that I'm convinced has a very positive effect in a large number of autoimmune diseases. The interesting thing for us is that almost every day there's a new disease, autoimmune disease, that I've never heard of. And pharmacists have got to do a certain amount of continuing professional development now to stay on the register. I've often joked with some of my colleagues that, I would come and, if you want to do your CPD, come and do a week in our dispensary, because the things that you have to research and find out about are so rapid fire coming through from the LDN department. But it's certainly been the diseases. One of the most amazing things with LDN are people with like fibromyalgia or me. You would never have thought, I certainly would never have thought would have responded. I'm not entirely sure who tried it first, but I know that Dr. Tom certainly has been using it for a while, and I'll never forget the patient who looked at death's door, just absolutely dreadful. She was exhausted, had been off work for months and months, and she just looked terrible. And basically, Dr. Tom had given her LDN as a last sort of, well, try this and see what it does. And I'll never forget meeting her again, 3 or 4 months down the line, and the woman was back at work, felt great, looked fabulous. I couldn't believe, that something had such a marked effect. It's very hard with MS patients to actually see a physical difference if you're the pharmacist, especially with us when we very rarely see people, because a lot of people are remotely from us. So it's quite interesting that the people with fibromyalgia, we can see a marked and quite rapid improvement in the people who respond, and also the people with psoriasis. There was a mini clinical effectiveness study done in Glasgow, and we got to meet a few people who took LDN for psoriasis, which is like a skin autoimmune disease. I mean, some of these people had absolutely dreadful psoriasis for decades, and they tried every cream, lotion, potion, and then 8 weeks on LDN, and it started to clear up. 12 weeks on the LDN, and half of them were clear. These are things that we you just don't normally see in normal practice. So I'd certainly say LDN for me has been very exciting, very interesting, but sometimes quite stressful. I'm sure pharmacy is stressful for most pharmacists, but this has been a very interesting and additional experience to my professional career. So.
Well, on that note, I would also like to say a personal big thank you to you for always being at the end of the phone to answer my numerous queries that people send me.
Always very interesting when the email pops up from LDN Research Trust. It's usually sort of, oh dear, what book do I have to open today? But yes, it's great. It's actually it's very interesting. It's fun. And some of the people we've met have been amazing, especially coming to the conferences. I've found those absolutely enthralling sometimes. Some of the most interesting presentations I've ever seen at sort of clinical conferences. I've been there, so very grateful to you for that.
Well, let's hope that next year you can say 10,000 patients. That would be something, wouldn't it?
Yes.
Aim high, aim high.
I'm sure there are more like 200,000 patients could easily benefit from LDN within Scotland alone. And there's so many people with autoimmune diseases. I think it's just a matter of time before this gets through all of the regulation studies and other doctors. I mean, there are over 300 doctors on our database who prescribe LDN. In the UK, a couple of years ago, that was about 6. So I think the LDN Research Trust has been doing an incredible job of promoting awareness, of this cause, and it's something which we hope to continue to be able to support for a long time.
I hope so too. And sadly, there are people being diagnosed every day with one autoimmune condition or another. So we're never going to be short of new patients, I'm sure. But to be able to help people and, in their own words, get their lives back is a really worthwhile thing to do, isn't it?
Yeah, I mean, no one treatment is the panacea for everything. LDN has certainly got its place in the treatment of quite a large proportion of the population who have autoimmune diseases, certainly by my opinion. And I can just hope that the studies that are going on are going to back all of that up. We get some positive numbers.
But like you said before, sadly, it doesn't work for everyone, but it's something that's well worth everyone trying.
Well, if you have an autoimmune disease, I always put it to the personal test. If I had an autoimmune disease, would I try LDN? And then the answer is yes.
Well, thank you very much, Stephen, for talking to me today.
No problem. It's good to talk to you again, Linda.